I hope you're all doing well. I actually hurt myself some days ago really bad on my neck. Like, I didn't even do anything special, but suddenly I had like a really sharp pain, like a cramp. I think it was my muscle. So I couldn't move my neck anymore. I was literally stuck like that. I couldn't turn or up and down. I was just lying on the bed and was still really painful. So I just went to the doctor, and it made me realize again how different Germany than Korea's healthcare and doctor system is. There are so many differences, so I just wanted to talk about it today. And keep in mind that that's all my personal experience, so I can just talk from my point of view about the things I experienced. So as I said, I went to the doctor, and that's already a big difference in Korea and Germany, just going to the doctor itself. In Korea, you can just go any doctor you want without any appointment, and they take you, and you actually don't need to wait long. I waited 2 minutes until the doctor called me in. In Germany, you cannot just go any doctor. Like, it's hard to go to a specialist. So what you would do first normally is going to your house doctor. It's called house doctor, and he's like responsible for everything. Like, he's the first doctor you go to when you have something. If you have headache, if you vomit, if you have a neck pain like I did, you just go that doctor first, and then that doctor would give you a receipt to go to a specialist. In my case, I would have gone to my house doctor first. The house doctor would have either just give me medicine or send me to a specialist for that area, and then I need to go to the other doctor again. Little bit complicated, right? And it's a bit annoying because you need to wait in 2 doctors, and Germany is not fast. Even if you have an appointment and if you go to a specialist doctor, you can wait hours, like literally hours. I'm just always really surprised how fast it is in Korea. That's a big difference. So I went to the doctor, and he did a scan, like to see my bones and stuff. And that also wouldn't happen in Germany. That would happen if you go to the specialist, but then you need an appointment again for the scan. You wouldn't get it immediately, except it's a real emergency. Yeah, I was just surprised. That's so easy. Like, I feel like almost every doctor in Korea has equipment to scan. A lot of German doctors don't have it. So you need to go special doctor every time. But you cannot go special doctor without the receipt from the house doctor. It's really frustrating. And they did a scan, and then after that I got medicine as well as immediate like massage with, they did actually 40 minutes of electro wave massages, so everything was done in like 50 minutes. And that's crazy. In Germany that could have taken you days. I don't know, Korea is just faster. I just want to give you one more example. Last year, when I was really sick, when I was coughing so much that I got inflammation in my ribs. And nobody knew why I keep coughing, so they did a test, like germ tests, and it took really long to come out the result. It took so long that until then I got better by myself. You know, if you have something urgent and you want to know what you have and you need special medication for that and the result just doesn't come, it's really bad, right? Because luckily I didn't have any strange disease or something, but if I need like antibiotics or something, it's better to take them as fast as possible and not carry it around for weeks. But the result didn't come, and what do? Like, I mentioned one more big difference right now, and that's the kind of medicine Germany and Korea use, especially antibiotics. Koreans love taking antibiotics for everything. I know not only Koreans, also a lot of other Asian countries as well. Doctors give you antibiotics so easy for everything. In Germany, the view on antibiotics is a lot different. Germans don't really like antibiotics. Like, we are a little bit scared of taking too much. We only really take antibiotics when we really need them. If you really have a bacterial infection and you really need it. They are also really strict in Germany about taking antibiotics. If you do take antibiotics, you need to take them exactly every 8 hours. In Korea, the orders are a little bit easier, which I was also surprised. If they give you antibiotics, they just say, oh, morning, lunch, evening, just take up with eating. But then the hours doesn't match up, right? If you take a morning and lunch, then it's only 4 hours. But from evening to morning, it can be 12 hours. So I don't know if Germans are just more strict or if they have different ingredients. I am not a scientist at all. I don't have any idea. I just noticed the use of antibiotics and the view on antibiotics is really different. Germany is really strict and you need to keep those hours and you only take them in emergency cases. And Korea is like, oh, you have a cold? Here is antibiotics. Oh, just take them with food. Whenever is fine. Like, but I grew up as a German, and I grew up with that mindset that antibiotics are just for emergency cases, and if you take them, you need to take them every 8 hours, and you need to take them right. I just noticed Koreans take a lot more medicine than Germans in general. Germans don't really take medicine a lot. Also, if you have a cold, you would not take medicine. You would drink a tea and maybe eat a bonbon to make your throat calm down. But in Korea, you go to the 약국 and you get like a package of different medicine. Yeah, just also the amount of medicine you consume is different. Koreans take medicine way more easy than Germans. One more difference in the 약국. When I went to the doctor and I got the prescription, and then you go to the 약국 and they give you the medicine. In Germany, you would go to the pharmacy and you would get the whole package. And then you have the package for later again if you need it. But in Korea, if you go to a doctor and he gives you medicine, you literally only get the amount that the doctor prescribed you. And then they pack it in those plastic bags with morning, lunch, evening titled, and then you just take it. And the first time I saw that, I was really surprised, because in Germany you just get the whole package with all the information you need, but in Korea you just get that pill, that packed pill. Also, one last thing I want to talk about is the medical checkups. So in Korea, every 2 years you can get a free medical checkup, right? Where they check your weight, your eyesight, your hearing, your blood, your everything. Everything every 2 years. That doesn't exist in Germany as well. We don't get that, but I really wish we would have that. But Germany doesn't have the capacities, and don't ask me why, but Korea has more doctors than in Germany. I'm sure about that. Korea has so many doctors, and every time I go to the doctor's office, they are empty or I don't need to wait long. In Germany, it's always crowded when you go to a doctor. You don't get an appointment sometimes for weeks. If we talk about insurances, what I noticed is in Germany, if you have insurance, the insurance is for every part of your medical treatment. Like, everything is included. Teeth, all the body, if you get pregnant, everything is included. But in Korea, you have a basic insurance. But as far as I know, like stuff like teeth or other stuff is not included, right? Then you need an extra insurance. And even if you have that basic insurance and other insurances, when you go to the doctor, the insurance doesn't cover everything. So you would always need to pay a special amount of money for the treatment. In Germany, the insurance covers 99%. If you really need a treatment, if you go to the doctor, you don't need to pay anything, except it's something not necessary. So the insurance would not cover like plastic surgery to make you pretty. If it's necessary for your health, they would. In Germany, the insurance is also a little bit more expensive than in Korea, but as I said, it covers everything. Yeah, but in Korea you normally need to pay extra. I think that's it. There was quite some differences I noticed. Yeah, as I said, that's just my personal experience and I'm not deep into that field. I don't really know about the laws and regulations and how the insurances and the doctor system works, but that are just some things I experienced by myself. I think I also changed my spot now because I keep being attacked by flies and other insects, and caterpillars are falling down from me from the trees. I don't know how many are on me already. But yeah, everybody stay healthy. See you in the next video. Bye bye.